So today I will be talking about teenage pregnancy. First, let's talk about pregnancy. Pregnancy occurs when a sperm fertilizes an egg after it's released from the ovary during ovulation. Technically, women can get pregnant and bear children from puberty when they start getting menstrual period to menopause. When they stop getting it, the woman's average estimated reproductive age is 12 and 51. Let's back in teenage pregnancy. Every year, an estimated 21 million of girls aged 15 to 19 years developing regions become pregnant and approximately 12 million of them give birth to adolescent girls younger than 15 years in developing countries. The estimated global adolescent-specific fertility rate has declined by 11.6%. Over the past 20 years, there are, however, big differences in rates across the regions. While the estimated global adolescent fertility rate has declined, the actual number of child to adolescents has not due to the large and some parts of the world. Growing population of young women in the age of 15 to 19 years old age group. Adolescent pregnancies are a global problem occurring in high middle and low income countries. Around the world, however, adolescent pregnancies are more likely to occur in marginalized communities, commonly driven by poverty and lack of education and employment opportunities. Several factors contribute to adolescent pregnancies and births. In many societies, girls are under pressure to marry and bear children early in these developed countries. At least 39% of girls marry before they are 18 years of age and 12% before the age of 15. In many places, girls choose to become pregnant because they have limited educational and employment prospects. Often, in such societies, motherhood is valued in marriage or union, and childbearing may be the best of limited options available. Early pregnancies among adolescents have major health consequences for adolescent mothers and their babies. Pregnancies and childbirth complications are the leading cause of death among girls aged 15 to 19 years globally, with low and middle income countries accounting for 99% of global maternal deaths of women aged 15 to 19 years. Adolescent mothers aged 15 to 19 years face a risk of eclampsia, puerperal endometritis, and systemic infection than women aged 20 to 24 years. Additionally, some 3.10 million unsafe abortions among girls aged 15 to 19 years occur each year, contributing to maternal mortality, morbidity, and lasting health problems. Adolescents who may want to avoid pregnancies may not be able to do so due to knowledge gaps and misconceptions, or where to obtain contraceptive methods and how to use them. Adolescents face barriers to accessing contraceptive based on age or marital status. Health workers' bias or lack of willingness to acknowledge adolescent sexual health needs, and adolescents' own inability to access contraceptives because of knowledge, transportation, and financial constraints. Additionally, adolescents may lack the agency or autonomy to ensure the correct and consistent use of contraceptive method. At least 10 million unintended pregnancies occur each year among adolescents girls aged 15 to 19 years in developing regions, and additionally cause of unintended pregnancies is sexual violence, which is widespread, with more than a third of girls in some countries reporting that their first sexual encounter was coerced. Quite many reasons that tend to explain why the cases of teenage pregnancies have continuously increased for the past decades. According to Youth Problems in the Philippines, The cause of teenage pregnancy include this reason. One, having sex before 20 is considered the end thing. Teenage psychological, which takes into consideration the, transition from childhood and peer pressure, lack of sexual education, lack of attention and affection from family, lack of parental supervision, overprotection of parents, and influences from social media. Many advocates believe that while certain efforts can be made to address the various cause methods above, sexuality education that can be implemented in school may be a key to curbing the rise of teenage pregnancy. The Department of Education, through the DepEd Order Number 331S in 2018, entitled Policy Guidelines on the Implementation of Comprehensive Sexual Education, which aims to enhance the holistic wellness of Filipino adolescents and effectively address their needs for health and protection while helping them make the right choices. I guess we need to embrace the reality that our adolescents are now sexuality active, and we need to take on a different perspective, instead instead curbing them away from engaging in sexual activities. I think that it may be better for us to provide them the things that they can do to prevent getting pregnant. Parents, guardians, teachers, and guidance counselors can provide the necessary advice to those who will seek such help and give them the information on how to practice safe sex and prevent pregnancies. Sexually transmitted disease, hard as it may be to accept that our young ones, since our country about early childbearing women, the Philippines has recorded a 7% increase in births among girls aged 15 and below in 2019, up from the figure in teenage pregnancies in 2018. The Commission on Population and Development said over the weekend in a statement on Sunday. PopCom cited the latest data from Philippine Statistic Authority, which revealed that Filipino minors who gave birth in 2019 increased to 62,000 from 63,000 in this 2018. This is the ninth consecutive year that the country has reported a rise in teenage pregnancies. PopCom warned in 2019, 2,000 girls considered as very young adolescents aged 10 to 14 gave birth, or almost 7 every day. Can you imagine that? This was a threefold increase from 2000, when only 755 from the said age group gave birth. The commission said it. It added that one in the three births among minors occurred in the three regions of Calabarzon with 8,008, National Capital Region with 7,546, and Central Luzon with 7,523 births. Outside Luzon, the highest number of minors who gave birth were in northern Mindanao with 4,747 cases, Davao Region with 4,551, and Central Visayas with 4,541. Population and Development Undersecretary Juan Antonio Perez III said they are coordinating with the Department of Social Welfare and Development for the Teenage Pregnancies Reduction Program as part of the government roadmap to reduce poverty. He added that a whole of government approach will be applied with the help of private sector, local government units, relevant government agencies, and other development partners to tackle the issue. Early pregnancy and motherhood varies by education, wealth quintile, and region. It is more common among young adult women aged 15 to 24 with less education than among those with higher education. 44% for women with elementary education versus 21% for women with college education. Those classified as belonging to poor households than those in wealthier households. The survey also reveals that 1 in 5 young adult Filipino aged 18 to 24 years had initiated their sexual activity before age 18. Some of them would have their intimate sexual act before marriage. The survey reveals that 15% of young adult women aged 20 to 24 had their first marriage or began living with their first spouse or partner by age 18. This proportion is lower than the proportion earlier cited regarding initiation by young women of an intimate sexual activity. Initiation of sexual activity before age 18 is more common among young women adults with less education and those in proper household. Over 40% of young adult women with some elementary education, compared with only 7% of those college education, reported having their first intimate sexual act age. Similarly, 30% of young adult women in the lowest wealth quintile, compared with only 10% of those in the highest wealth quintile, had their first intimate sexual act before age of 18. Hard as it may be to accept that our young ones are already liberated, but this is the reality we have to deal with and we should face the head on now. That's all my talk. Hope you learned something. God bless.